Hi, everybody. It's Dr. Rose Kumar from the Omani Center for Integrative Medicine. I just wanted to take a few minutes and offer a few suggestions during this unknown time. People are quite frightened right now because of the second wave that's upon us, and there's a lot of unknown as to how to take care of ourselves and what to do given that this virus is now mutated and we don't have a vaccine yet and we don't have any cures yet. So when we're in uncharted territory, we want to access what we do know. And in medicine, physicians are trained to think level-headedly, to apply expertise and scientific method in a crisis situation, which is what I would say we are in right now. So many physicians are working on the front lines very brave and courageously to assist patients that have COVID requiring hospitalization. And those of us in primary care, our job is to help educate you with what we do know so you can take care of yourself. So we do know a lot of things, and I want to share some of them with you, but there is so much to share that I have actually created a webinar that is going live on Wednesday at 4 p.m. Central Time, and you can access the link to this webinar on rosekumarmd.com. And it's the COVID update webinar, the most recent one that says that it's going live on Wednesday. So feel free to access that either live or after it's aired if you can't attend it live. It will be full of information for you so that you can gain a toolbox, an arsenal to take care of yourself during this second wave. So a couple things we do know that we can do to prevent spread. Wearing a mask has been shown to be exceedingly helpful to reduce air droplet transmission, which is how this virus spreads from person to person. So even if you have a mask that's not great, it's better than not having a mask. So it's really important to wear your mask when you're in a public place, not just to protect yourself, but also to protect others in case you're an asymptomatic carrier of COVID. A cotton mask that's double-lined is the best for people in the community. It actually reduces transmission at a high percentage, up to 90% of reduction in transmission. And associate that with social distancing, 6 feet or more, as well as hand sanitizing with a hand sanitizer that is 60 to 70% alcohol or more, as well as frequent hand washing. So when you go to the grocery store, bring your hand sanitizer with you, wear your mask, and hand sanitize as many times as you can remember to, particularly after you leave the store with your cart and are opening your car door. Hand sanitize before you open your car door so you don't cross-contaminate yourself. Another thing that I'd like to actually discuss that has evidence that it works for antiviral protection is vitamin D. Vitamin D3 is extremely inexpensive and extremely effective in its antiviral properties. It punches holes in the capsules of a virus, killing it. It also opens up the pharmacy in our body for producing antimicrobials and antivirals. What we've also found is that vitamin D encodes for or turns on genes that code for a protein that creates caps on the spike protein of the coronavirus. So it actually intercepts its docking mechanism on your cells. So vitamin D is a really easy way for you to protect yourself and make sure that you check your vitamin D level through your primary care physician to make sure you're not taking too much D. The second supplement is a broad spectrum probiotic, one that contains at least 5 L's and 5 B's, 5 lactobacillus, 5 bifidum, and a Saccharomyces boulardii. That is your arsenal for your gut, but your gut is only as good as your diet. So the probiotic is not going to work if your diet is not good. So the diet is the next step that you can take. It's harder to change your diet, but look, it's really important that we eat lots of fruits and vegetables, a Mediterranean diet, lots of lentils. All of these foods increase nitric oxide in the body. Nitric oxide is a gas that your body produces based on the foods that you eat, and that increases your blood flow, your oxygenation, your collateral circulation, and it reduces the possibility of forming clots, which we're seeing in hospitals people are getting with COVID. So increasing nitric oxide in the body naturally is through a whole food plant-based diet. Don't use mouthwash if the mouthwash contains chemicals, because the nitric oxide production begins in the mouth, and mouthwash reduces the bacteria that produce this. And so you really want to not put chemicals in your mouth that can intercept nitric oxide production. The next piece of information that I'd like to offer you is just please keep your liver clean. Your liver is your first responder to any kind of an infection, particularly a virus as well. And when a virus invades your body, the liver gets the message that there's an invader in the body. It mobilizes soldiers, which are macrophages. There are immune cells that gobble up the invaders and get rid of them. So if your liver is not healthy, you are not going to have the benefit of reducing the load of the virus in your body early. And then the viral load will grow, and you'll have a much more severe case of COVID that has a much higher risk. So the way to keep your liver clean is a whole food plant-based diet. Avoid alcohol right now, particularly because we want that liver to be robust and able to respond if you do get viral particles in your nose or in your lungs. So if you want a deeper dive into some of these techniques and tools, please feel free to visit rosekumarmd.com, the COVID update webinar, and join me live on Wednesday at 4 p.m. Central Time if you'd like to be present live, and you'll have a chance to ask questions during the webinar. And I will put the link on the little description at the bottom of this YouTube video, but also please feel free to subscribe to my channel, and I will be updating these videos more frequently as more discoveries come out about COVID, and keep you informed as to what you can do, because there is a lot you can do to take care of yourself. So without further ado,